Hello, I'm David Forte, Senior Policy Advisor with the Washington State Office of the Insurance Commissioner. This year, Commissioner Mike Kreidler is continuing his annual Climate Summit in virtual format by creating a series of videos with experts from around our country. Today, I'm here with Dr. Kris Ebi, a professor at the Center for Health and Global Environment at the University of Washington, and an international leader looking at the effects of climate change and human health. Kris, thanks so much for joining us today. Would you tell us a little bit about your work?
Thank you, and thank you for inviting me. As you said, I work at the intersection of weather, climate change, and health. I've been doing so for about 25 years. I've had the privilege of working both nationally and internationally, and work with countries around the world and thinking about what are the risks that they're facing and how do they best adapt to those risks. I also work on the health co-benefits of mitigation policies and technologies.
So, Kris, today Commissioner Kreidler has asked us to talk about extreme heat events. And what are the impacts of these extreme heat events with public health?
Heat affects us individually. There's other extreme events that also affect us individually, affect communities. But with heat, we're really worried about individuals, particularly vulnerable individuals. What we focus on is our core body temperature. It needs to stay within a narrow range to protect our cells and our organs. We have physiological responses and behavioral responses when the temperatures go up. Sweating, for example, to try and reduce our core body temperature, finding a place to cool down. And if we can't, at some point we start affecting our internal organs. It depends on each individual's physiology, it depends on your age, a range of factors. What you see after a heat wave is about half of the excess deaths are from cardiovascular causes. And so you see people dying from heart attacks, for example, who wouldn't have died from a heart attack without the heat wave. You see people, particularly older adults over the age of 65, outdoor workers, pregnant women, people who live in red line districts. There's a long list of people that are affected by these much higher temperatures. After an event, we do an analysis of the death certificates, we do analysis of the number of hospitalizations, and they are elevated, and sometimes they're excessively elevated, putting real strain on our health systems.
Is there preventive care for heat events that people should know about?
There's quite a wide range of actions that can be taken. At the individual level, there's a lot of actions that can be taken without using air conditioning. We don't all have to have air conditioning. Things like putting a cool towel around your neck, putting your feet into cool water, sitting in front of an electric fan and spritzing yourself with water so that the water evaporates. It's really important that people get that core body temperature to be within the normal range. There's also actions we can do at the level of our cities, particularly heat wave early warning and response systems, with the emphasis on the response. It's not just our lovely broadcast meteorologists, we've got great ones here in the state of Washington telling us hot. We have to know what it is that we can do. And we need to think about how we coordinate the kinds of activities that can take place, everything from EMT to our utility companies, people who reach out to the elderly care facilities, people who reach out to the unhoused, and have that collaboration so that people know about the risks and know what it is they need to do to protect themselves, their friends, and their families.
Mm-hmm. And that makes me think, so during the heat event, we probably need to be much more mindful about our neighbors, and we need to check in on them a little bit more. How quickly can heat affect somebody?
Typically, when we experience high temperatures, it takes about 24 hours before mortality starts to increase. And in that 24 hours, of course, people engage in a whole range of activities. Some can increase their core body temperature, some bring their core body temperature down. But making sure that there's periods of time where people are in a space where they can cool down. Mm-hmm. One of the challenges with many of the vulnerable groups, adults over the age of 65, and people who take certain medications that reduce the ability of the body to sweat, is it's difficult to tell you're getting into trouble with the heat. one of the first symptoms is people get confused, which is not helpful to know that you need to take action, which, as you said, is why we need to look out for our families, our friends, our neighbors, our colleagues, and make sure that we're paying attention, that it doesn't look like they're having trouble.
Hospitals often become the hub of the community during crises. Is there anything that hospitals should be thinking about before the heat event occurs? Things they can do to better prepare themselves?
There's two main threads. I'm sure there's more, but I'll focus just on two. One is the skill in forecasting a heat wave has really increased in the last decade. And this is an opportunity for hospitals to say, we're going to have an increase in hospitalizations. And are there things we should do about rearranging our services? Are there procedures that we could put off until after the heat wave so we've got the capacity in the hospital? And those analyses are relatively easy to conduct. The other is to have planning for what's going to happen, particularly in the emergency departments, because there often is a large influx of people coming into the emergency department, putting lots of pressure. During the heat dome in the northwest of North America last year, there was a 69-fold increase in heat-related presentations to hospitals. And if you're not prepared for that, on top of COVID at the time, it was a real challenge for the emergency departments. And so doing the planning in advance is critically important. One small example is that around King County, one of the ways that the emergency departments were cooling people down was to put people into body bags and put ice in the body bags to cool down that core body temperature. And one of the emergency departments almost ran out of ice. That advanced planning is critically important, so you've got everything in place and you're ready for when people start coming in.
Should we believe that these major heat events aren't going to come back? Or is climate change creating a situation where we should be more prepared for those type of dramatic events?
We have to be more prepared. These events are coming back. They're coming back more frequent, and they're coming back more intense. Observations show us that there has been an increase because of climate change in the frequency, intensity, and duration of heat waves. And as we've looked around the world, around the United States, right now there's something like 49 million Americans under a heat alert. The temperatures we're seeing are absolutely unprecedented, as happened here during the heat dome, and we have to be prepared for these in ways we haven't been before.
So what about other health facilities? And I'm thinking of skilled nursing facilities. What steps should they take to prepare their staff and their patients as well?
It's a good question, and there's lots that can be done in terms of raising awareness that heat is often considered a silent killer, that it just isn't something that people pay attention to. People often don't think of heat as a killer, and yet it's the number one weather-related killer of Americans. We do need to have more awareness that heat is such a risk to certain groups of people, and we need to have policies and plans in place. So one thing that skilled nursing facilities, for example, can do, emergency departments also can do, would be stress testing. Banks do stress testing, military does war games, of having some kind of desk-based exercises where you get people together and work through a scenario that you haven't seen before and think about what you need to do to be prepared so that you can get that process started before they're faced suddenly with an influx of people who are in dire straits.
And the energy grid becomes extremely stressed during these events. Should communities be thinking of microgrids or emergency charging stations for medical equipment? Is there any life-saving events that communities should be thinking about relating to energy?
Energy is critically important. We're seeing right now in California the request for everybody to reduce their energy use because they just don't have enough. And it's not one option, it's a basket of options. and looking at what's going to be most effective and most efficient in a particular community to make sure that you do have the access to energy that you need. And to think about using, for example, the new IRA to have more people put on solar panels, and so you've got more solar generation, so that you've got access to energy when we have these high events, so that we can have the equipment running that we need to have running.
Looking ahead, how do you forecast our response to the threat of climate change? Are you hopeful that society can step up to the challenge in front of us?
I'm a worried optimist. We have what we need. There certainly is more technology we need, but we understand many of these challenges, and we've got skill in terms of projecting what we're going to see for the next few decades. We've got the information. We need to have the political will. We need to raise the awareness. We need to make sure that everyone understands how critical it is that we prepare for a very different future. Not just for our children, and there's always a focus on making sure we protect our children, which I agree with, but also about our own individual futures, because we are going to be affected by the changes that are coming. So yes, we need to have everybody on board, and we need to get moving rapidly to make that happen.
And I know that you're involved with many international groups and national academic groups. Do you have anything coming up that we should be looking forward to?
It's always a little cautious to say looking forward to something in climate science, because usually the news is pretty bad. And there is quite a bit that's going to be coming out. Of course, we had the publication of the Intergovernmental Panel on Climate Change. There's a series of papers coming out from something called the Earth Commission, looking at other global changes. There's a paper published just yesterday in Science looking at tipping points in a range of our Earth systems as we increase our temperatures and as we see changes in our ecosystems and in our oceans.
Fantastic. Well, Kris, thanks again
Sure.
for joining us today. And we'll have more series coming up in the future here for the 2022 Climate Summit. Please check our website. Thank you.